All right, we're just waiting for him to join us here. Let's see. There he is. There he is, the mentor to many.
Hey.
Good morning.
My favorite folks are all here. All right.
Med students, more people taking the plunge into the strange world of medicine here.
Very strange world. Yeah, sorry, just got off a Zoom call.
That's all right. All right, so everybody stay quiet. Let's get this thing rolling here. Hang on. Hey, welcome back, everybody. It's time once again for another episode of Health Talks with Dr. Trin. The one show, the only show that shows you the path to a healthier life. And apparently for some people, it's going to med school. Is that true, Dr. Trin? Is med school the path to a healthier life here?
Med school is always healthy.
It seems like an unhealthy thing to do. It's got to be like 800 hours a week and no sleep. It seems like the last thing you do. The people who are supposed to know about health don't seem to practice it in the first few months or years of their medical school practice. And to find out if that's true, you brought a couple of real life med students. I didn't think they let them out even for a moment to talk.
Yeah, they were. You were allowed to escape the class, huh?
Just for a moment.
Oh my word! Are we on Facebook Live right now?
We should be. Yeah, I think so.
Let's see. Okay.
So introduce yourselves. We got Isabelle and Stone here. Isabelle, we'll start with you. What the heck are you doing in med school, and why are you talking to us this morning? You should be studying.
I know I should be. I think I saw Stone was up at 6:02 trying to get in our morning lectures a little early, but this is what we do it for, the future of being a doctor, not just for sitting through biochem lectures all day. So yeah, I'm a first-year med school student at Western University of Health Sciences along here with Stone. We just started a month ago, and I think it's kind of flown by, but also seemed like I've already been there for a few years.
So Stone, is it sort of like joining the military? Is it hazing? Is it rough the first month? Do they try and break you down? What's the first month like?
There's definitely an adjustment process. Coming from the summer where the last few weeks before school, I was just laying in bed watching Netflix, and now I am
the good old days, yeah.
Yeah, and now it's just, I'm on my screen now 8 to 10 hours a day, looking up videos, figuring out pathways. There's definitely an adjustment.
So Dr. Trin, how many years ago was it that you went through this?
Way too long ago.
Way in the caveman days, right?
Did
they use leeches?
In the 90s. In the 90s was med school for me.
Did they
so
teach
that was
you?
when we were still treating, diseases with leeches maybe?
That's what I was going to say. Did you have leeches?
Bloodletting?
Yeah.
So way too long ago.
So what I can't understand, and I don't think anybody could, I went to law school for a year, hated it. But I was not prepared for the intensity of law school. I did well in college, but I did well partying and doing other things too. And when I got to law school, you were supposed to go to school all day and then basically study all night and then get up in the morning and do it all over again, day after day after day. I'm like, well, can't we put this aside? Well, not unless you want to fall really far behind, because you got 400 cases you got to review and you got to stand up and in the class and recite and talk about here. Talk about that. Is med school a big jump from college? We'll start with Isabelle.
I've always been somebody where the sciences are actually a bit of a challenge and a struggle for me. So even through undergrad, I was that kid who had to work a lot extra to kind of reach my peers. But I love it. And that's why I'm doing it, because what's easy isn't always what you love. So I think that that's helped me a bit getting to med school because I'm used to having to work to keep up with people. And the different thing about med school is, yeah, it's hard and there's tons of hours and it's a huge adjustment, but you're doing it alongside 240 other kids who are going through the exact same thing. So it's not like I'm studying alone in my room in the dark for 16 hours. It's right. I'll go outside, or Stone and I will take a break. And it's really nice to have that support.
What do you think, Stone? Were you prepared for the intensity of med school?
I don't think anything can prepare you for the intensity of med school. I think Isabelle said it perfectly. You have to meet people here and work collaboratively, because doing this on your own would be really, really difficult. I think that's one of the biggest differences between medical school and undergrad, for sure.
Maybe that's what I missed in law school, because I felt very alone. You sat in class all day. You didn't talk because you're listening to a lecture, you're taking notes. And then the minute you got out, you went and got something to eat, whatever time of day it was. And then you were supposed to go right back to the library. And it wasn't I guess some people tried to do it as a joint thing, but it really is a solitary thing. You're just reading and reading and reading and taking notes and trying to understand this case in front of you and break it down and do all this. And it went on till 11 o'clock at night, easy. And lucky you, if you succeeded and you got into, what do they call it? The thing where the law review, then you're supposed to stay another 2 or 3 hours. That's your reward. You get to stay up another 2 or 3 hours and work on law review. So I just found it completely burned me out, and I didn't have the passion for it. That became very clear. So what, anybody doubt themselves at this point in time? Do you say, what the heck am I doing, Isabelle?
A bit. They do a really good job at our school of telling you that that's normal. And they talk a lot about this thing called the imposter syndrome, which is when you believe that you don't belong there, that they made a mistake in who they chose. But something I've just kind of been holding on to is my faculty advisor said, when you don't trust yourself, trust the statistics. We know who we picked. We know that you can do this. So if you don't believe that you're doing a good job, just trust that we chose you because we know you can do it. So wow. I've been kind of holding on to that, certainly some days with self-doubt and some tough times, but it's good to know that I put in the work and somebody decided that I belong here.
So, and what for you, Stone? Same thing. Any points early you're saying, man, I don't know if I can handle this. I don't know if this is for me. I don't know.
I think the end of my first week was a moment where I sat down and really had to think, am I going to be able to do this? Mm-hmm. And I think this is a point where having people that you can reach out to, like Isabelle, that was so important, because we sort of reassure each other on our abilities and how intelligent we are, because we're really surrounded by, so many intelligent people here that it's so hard not to compare yourself, And so I think having people that keep you in check is really, really important.
So what is it like, Dr. Trin? Can you remember those dark, lonely days?
Yeah, it's like being in the trenches. It's like, man, this is tough. I'm getting shot at, and what I mean by shot at is like, all this pressure is on me.
It's being shot at, yeah.
Schoolwork. But at the same time, you're like, this is tough getting shot at, but the person to my right is doing the same, and the person to my left is doing the same. So we're gonna do this together, although it's totally hard to do that. It's kind of like being in the trenches in a war. You have all your classmates that are all in the trenches with you.
Now, here's one of the things I observed, though. Maybe I just saw it from a different perspective because I wasn't loving it, and maybe law school's different, but I suspect they're very similar. Yes, there was a little kind of support, but they were always checking you out, because ultimately you're being ranked in your class, and the top 10% are going to get the bigger, better jobs and the bigger, better offers and assignments. So you're very I wasn't conscious. I don't know where I ranked in college. There were 50,000 kids there. I didn't care whether I didn't feel in competition with the person next to me all the time. And there were many students in my law school kind of like, hoping you'll falter, maybe not that directly, but they certainly wanted to rise, and they certainly weren't all there to make sure they saw you as competition. You feel any competition right now to be at the top of the class, Isabelle?
There's a phrase that goes around that's gunner's gonna gun, and it just means that there's always going to be those people who are there for the top spot, and you just can't let them get to you. But There's also what I just think of as reality checks. Take a second. You want to help people as a doctor, right?
Right.
So don't you want to help people now? Like, these are our peers. These are who we're going to be going to for medical advice or advice on a patient, stuff like that. So we need to form those relationships now. I also know that, every student, no matter how competitive or how worried about the test they are, there's some level of humanity there. I mean, we've had a couple students already with family members pass away, and I cannot imagine anything making the first year of med school more difficult. But then you just see a team of kids rally around that one student. Here's all of our resources. Here's everything. We're going to get you through that test. And it's really beautiful to see even the most competitive or scary students also show that they're good people and they just want us all to make it through.
Boy, you're speaking. The college should be taping this and playing this. What do you think, Stone? Tell us the truth. Isn't everybody cutthroat and out for each other here?
Oh, I mean, I think coming into medical school, I was definitely expecting more gunners for sure. I was pleasantly surprised how many people are really supportive, want everyone to do well. And I think that just stems back to the fact that as future physicians, grades are important, but there's a whole nother side of medicine. There's a whole patient interaction that we have to manage. And I think navigating that is just as important as grades.
Wow. Spoken like future doctors here. What do you think, Dr. Trin? Was it cutthroat in your day, or was everybody kumbaya and out to help each other row the boat together here?
I don't know. I never went to class much, so.
What a guy.
I think it was cutthroat.
You cut class.
But, you just knew. I kind of, when I was in med school, I just kind of competed with myself. I didn't really necessarily look at what the others are doing or how competitive they were. It's just you having to learn the information, the anatomy, the physiology with that.
But how do you learn this confusing? I'm always amazed, baffled. The doctors rattle off. Dr. Trin will do it. Every doctor I've ever met. The azabam something, and they're just rattling off these long, complex terms I've never heard about, one after the another. The drug, the part of the body, the this, the that. It's this giant memorization of mystifying words that you mumbo jumbo to the rest of us. How do you manage that, Isabelle?
Well, I think that's actually where you will see the most competition is people trying to convince you that their study technique is the best. Once somebody latches onto a study technique, they want everyone to do the same.
This is it.
But I think what it comes down to ultimately is never go into something with the purpose of memorizing it. Memorizing is an understanding, and you're not going to remember it long term. So I think that the best students are the ones who it's easier said than done, but the really good students, the peers that I look up to, are ones who fully understand what's happening in that pathway rather than just rattling off the names. The great thing too is we have counseling for studying. So there's a whole team of counselors who will tell you, recommend good study techniques, but also help refine the ones that you like, so that way they fit your preferences. I mean, Stone and I study pretty similarly, but then there will be random things that I absolutely hate and he loves, and they really work for him. So it just depends.
So how do you memorize the mumbo jumbo, Stone?
Just tons of repetition, especially on the things that I'm weaker in. If I notice I'm particularly weak in one lecture, I'll set aside 45 minutes or an hour one morning, just wake up extra early and go through it multiple times. For me, talking out the pathways out loud is really helpful.
Because you watch these movies, millions of Hollywood movies have been made about going through med school, and it's always intense and people crack under pressure and all the stuff that happens, and it's, awful. Days and nights without sleep, trying to just cram an inhuman amount of information into a human brain here. And yet, I think Isabelle hit the nail on the head. What do you think, Dr. Trin? It's more important to understand it than memorize the exact term. But we're all just trying to, in law school, I was just trying to memorize stuff constantly trying to memorize.
Yes,
I didn't care about whether I understood it. I just could rattle it off on the test. Repetition, long lists of cases and other sorts of things I would just memorize.
Yeah, even more important than answering the what. The what is what you're memorizing, right? The Krebs cycle, the antibiotics. More important than just thinking about and memorizing the what is to ask why.
Yeah.
Why is this function here? What is the purpose of the Krebs cycle, right? What is the purpose of this bacteria, this antibiotic? What is the function of the heart? And ask the why, because that's when you get down to anyone can memorize what, but to be a good doctor, you have to know the why.
Well, I didn't know why I was in law school. That's clear. All I was doing was just felt like I was sinking in a sea of information while everybody else is out, rising above me here, and I'm struggling to stay afloat. And it became harder and harder and harder and clearer and clearer and clearer. This wasn't for me because I didn't care. I had no time for why. I was just so overwhelmed what I had to learn. And at the end of the day, I had to ask myself, why am I here? There must be kids that drop out of med school like me and dropped out. What's the percentage, Dr. Trin? Is it, Isabelle says they've picked well, so most of them will succeed, but I suspect a bunch of them quit.
Are kids dropping out? Do you guys know, Isabelle, or too early to tell, really?
Too early. Yeah, it takes a while.
I don't know the stats, but I think that they said a few kids drop out, but it's almost the kids who drop out, it's almost never due to academic reasons. It's almost always due to personal and family reasons, and they end up coming back. We do have a few kids who are repeating the year, which I think Stone and I are most admirable of those. We look up to those people the most because they're incredibly strong. They went through this once and now they're doing it again. Stone, do you know how many people drop out?
I don't know. I think I read a statistic somewhere, this could be wrong, that it was around the upper range of 10%.
So a small number, but yeah. Well, yeah. I became clear to me that I didn't belong there. I lasted the whole year and I made myself sick, really. I got sick, mentally, physically exhausted. And by the end of the year, I couldn't imagine coming back. And it's clear I had no passion for it. I don't know why I was doing it. I guess it was just like the thing to do. And so at some point you have to really gut check yourself. I'll tell you another thing that came to me in law school, though, is at some point the mumbo jumbo started to make sense. It took me about 6 months, because most of it's in Latin, all these old Latin terms and everything here. And all of a sudden you go, wait a minute, this isn't as confusing as I thought it was. You get past the verbiage and the concept. Maybe that's it. It becomes clear. Is the fog clearing at all, Isabelle? It's only been a month. You're in the fog right now.
I think it's more like little bursts of fog right now where I'll come up for air for an hour and be like, oh my gosh, I totally understand this. And then there will be the next lecture and I'm lost again. So I think it's a lot of give and take, but I definitely, comparing where I am now to where I am the first week of school, I feel much more in the groove and I'm hoping that continues. I'd say that there's still rough days and still really hard stuff, but you just learn to deal with it better and not freak out, if that makes sense.
What about you, Stone? Foggy? Still foggy, or is it starting to make sense?
I think that we try to embrace the small victories. Yeah. There's so much material that we have to go over, and if there's something you don't know, reviewing it with a friend or something like that, and having it make sense is such a win. So we really try to just take it day by day, figure out each day as it comes, instead of looking too far into the future.
So in law school, there was a saying that they said law school's 3 years. I forget how many years is med school? Is it 3 years and then plus residency?
4 years plus residency.
4 years plus residency. Okay, law school is 3 years. And the saying was they would teach you all very early. Some upperclassman would always teach you this phrase, and everybody'd pass it down. The first year of law school, they scare the hell out of you. The second year, they work the hell out of you. And the third year, they bore the hell out of you. So I don't know. None of that sounded promising to me. What about you guys? Are you feeling scared, overworked, or you're probably not bored yet?
Certainly not bored. I think that we all look forward to years 3 and 4, which is when you get into the clinical stuff more. And that's actually when we're more hands-on and working in hospitals and stuff like that. So even though it's harder because you have greater responsibility, it's more fun, in my opinion, and it's less book time. I'm so sick of being on a screen. I'm a little scared about that for the rest of the year. I mean, I get a little bit of outside time. It sounds like prison, outside time, and a little bit of workout time. So I'm more worried about that sort of health stuff, but really excited to make it through the first 2-year grind and then get into working with my hands.
What about you, Stone? Are you bored? Are you scared? Or are you overworked? Or all three?
I feel like if you're here and you're bored, you have to think to the reasons why you want to be a physician.
Yeah.
That's been something that's helped me get through some tough times already. Just sort of thinking about the experiences you've had in the past and what's motivated you, to pursue this path.
So what happened? You opened the door. Now answered the question, young man. Why do you want to be a surgeon? Why do you want to be a doctor here?
Doctor.
Yeah. So for me, it stems from an interaction I had when I was young. I played baseball my whole life through college, and I had an elbow injury when I was maybe 12 years old. And so I came in to see an orthopedic surgeon, and he told me that you're never going to play again. Your elbow's done. You should quit now. You probably wouldn't make it that far anyways.
Yikes.
Wow.
To me, I couldn't have heard anything worse.
Yeah, right.
I think I went home and cried all night. And the part that really changed me was we decided to get a second opinion from another physician. He said, we can take a little bit of an unorthodox technique, but I think we can heal your elbow. And we worked with him. He performed surgery, months of physical therapy. And after 2 years, I was able to play again and ultimately play in college, which was one of my lifelong goals.
Why are so many doctors mean, Dr. Trin? I mean, you seem like just a nice guy. Some of the people you bring on seem like nice guys. I've seen mean doctors. They just give you this blunt assessment. You're going to die. You're not going to play baseball again. That's it. Next, quit, just get over it. I'm sorry for this, but
I don't know. So sometimes they get into a daily grind where it becomes stressful and sometimes you kind of lose the compassion along the way.
Yeah.
And so, but I don't think that's gonna be a situation where Stone or Isabelle have to worry about.
No, I think
unless they're surgeons. I mean, surgeons are like
surgeons are mean. They are. Some of the surgeons are the meanest. They're just like very little sympathy because they see you as a science experiment. They stop seeing you as a person. Oh, this will be interesting. Let's see if I can do this. Oh, that didn't work. Oh, well, next.
I don't know about that, but
what do you think, Isabelle? Am I being too rough? Are there mean professors? I bet they're mean professors. Come on, there's mean professors everywhere.
I don't know. I think that we sometimes forget that doctors are just people too. They have good days, they have bad days.
Yeah.
I was a medical scribe, and I had days where we were back to back in clinic, and I hated to see another patient. I was like, why do you have so many questions? I don't want to write you a work note. And then the next day I'd absolutely love it. So I think I've probably made those mistakes too. But Stone and I are also at what's called a DO school, which is a school of osteopathic medicine. And there we sort of have classes on how to be nice. When you go to a Trader Joe's and all of the employees have to be super nice to you and ask you a lot of questions.
Yeah.
Yeah, we sort of have classes on that of here's how to make a lighthearted joke in an appointment.
You're kidding. You're actually role-playing this out.
Really? How to be nice? There's a class of that?
Well, it's called CMNR, and it's our class on how to be a doctor. And they spend a lot of time focusing on Stone can tell you about it. We had an empathy and humanism interaction where we just had to practice talking to a fake patient. They're called standardized patients. They're actors. They're amazing. And you just had to empathize with them. And it was really cool to get to do that because I don't have medical knowledge right now. I can't tell them how to fix the problem, but I can practice being nice.
What do you think, Stone? Do you have to practice? Does it help to be nice? Is it practice?
It helps a lot to practice being nice because you don't know what sort of situation your patient is going to be in. Isabelle was saying we had these standardized patient encounters. And this, I think, was the second week of school. So we really haven't had any experience talking with patients, and all of these patients had really different scenarios that forced us to adapt and figure out how we should react with these patients. Because even though you know it's not 100% real, in that moment you're feeling for that person's situation.
Yeah, right.
Wow, I think I missed that niceness class.
I think you did. Yeah, you go back to school again. Yeah.
So for the kids who failed the niceness class, do they get categorized into like the surgery, pathway?
Yeah, they're surgeons then.
Neurosurgeons. You're not so nice. No longer primary care option, right?
Right here.
You go to
They just funnel you through. Yeah.
You're a proctologist from now on here. Yeah.
Exactly. Oh, pathologist. Pathologist. You don't have to interview any patients if you fail the class.
Yeah.
So
that's really interesting, and I'm glad to hear that, because one of the common complaints about doctors is that somewhere along the way they become, and we've even talked about this thing, the system sort of encourages you very little time, keep the assembly line moving, that you have to be detached, you're never going to get through this. If you break down and cry or get too wrapped up in any one case, you're a lawyers, you're not supposed to sympathize or worry about whether your client did it or not. That's not your job. Just figure out the best case you can do. Keep your head focused, and don't get too wrapped up in the personality of the case. Because if you win or lose, you don't want to be crushed, and so you just you're there to do a job. You go in and do it, and don't get too wrapped up in it. What do you think, Stone? Is that sound advice, or do you have to really remember the people that you're serving and allow yourself to get maybe sucked into that? Or where do you set the boundary?
I think as a physician, there's a level of mental toughness that you need to have. And I think our school does a really good job of letting us know what we're up against and preparing us for that. I think that at one level you do have to, perform your job, and you can't let certain patients affect other patients. You can't let yesterday's work affect today's work. Right. But at the same time, humanism and empathy is something that is so important, and is something that's going to make us better physicians. So I think that is something that we really have to emphasize just as much as the former. What
do you think, Isabelle? Do you have to draw a line? I would think you have to draw a line. You can't totally get sucked into every patient, because then you go home devastated. Look at Doctor. It's a horrible example. I'll give you a chance to answer, but look at the horrible example we're going through with COVID. We had people on this show talking about how many doctors and nurses are ending their life. They get so overwhelmed with not just the physical burden of what they're doing, but the strain of seeing people suffering, and I can't help them, and I can't take it anymore. Where do you draw the line, Isabelle?
Well, I think I'll let Dr. Trin speak there to the physician side, but I know, at least from what we've been learning, we did have an interesting lecture that was on like myths of becoming a doctor. And one of those myths was that you can't get emotionally involved, right? Because you absolutely can. I mean, I feel like the doctors I've had the best care from are the ones who really know me as a person, and who, when they see my name, they don't just think of my diseases, but maybe they think of my interests and my hobbies and stuff like that. Wow. And all of those things can contribute to increasing and improving patient care. But I think that the line is just drawn when is my investment harming patient care? When is it taking too much time away from other patients? When is it making me so emotionally involved that I can't perform a good surgery? So it's a tough balance, but I think it's just finding where does the line of care stop improving and sort of plateau.
So they're looking ahead, Dr. Trin. You're looking back. Were there times you got too emotionally involved, or were there times you should have been more emotionally present and involved? Or is that just a day-to-day struggle?
It's a good balance, because you don't necessarily want to take every patient's worries and concerns home with you when you leave the office, right? So somewhere there is a silo that you create for your work life, and then for your personal life. But at the same time, it's important that, as Isabelle say, we're humans, and so we and if you're a good doctor, you're a caring doctor, and each person in front of you is somebody that you want to give the best care to. You want to treat as family. and you are somewhat emotionally invested if you treat them as family. So super important to do that.
So it's a fine balance between
yeah.
feeling for them, but not letting yourself get, because some of these people have horror. Give me an example. Don't give me a name, of course, but can you give me an example in your life where it must have been a patient, Dr. Trin, that just really got to you, and you're like, oh my goodness, well,
there's a lot of patients that I've had actually really good experiences with. By the way, on Facebook, Dr. Natalie says, there's a lot of nice doctors, but burnout leads to compassion fatigue.
I'll bet. Yeah.
When you're tired and things of that sort.
Overwhelmed and
overwhelmed. Yes.
Does the system, we'll let you go back and answer the other question in a second here, but I'm just thinking out loud to answer Natalie's question here. I'm wondering if the system of medicine as it's set up today doesn't almost provoke burnout, meaning you've got long hours, you got to see a lot of patients because they don't want you dilly-dallying, not just so you make more money, but the Medicare only pays so long, and they want there's a shortage of doctors and a lot of patients, whatever reason you want to put it at. We've talked about the system almost encourages you to be like an assembly line, just to keep going and keep going. And that means it limits the amount of time you can spend with every patient. And I wonder if that doesn't burn out doctors. What do you think, Dr. Trent? Should we slow down?
There is a legitimate point there. If you survey physicians, and surveys have been done on a yearly basis, and if you survey doctors, there's a good number of them that are saying, I'm burnt out and I'm planning to retire sooner than later, right? Or I'm seeking a different type of work as a doctor than seeing patients. Burnout is a good possibility. Part of that is due to the fact that, we're a country where we have a growing population. More folks are getting older. More folks need primary care physicians, and there isn't enough.
Right.
And as a result of that, the current number of primary care physicians are taking on a heavier workload in taking care of more patients. And so, most of our health systems, it's, 20 minutes a patient, 15 minutes a patient. And that's not because the health system is being mean. It's because we're trying to match that demand for patient care with the existing number of docs. And if you don't have a lot of docs, then you try to see more patients per hour.
So I'll go one step further and I'll let the kids back in here in a second here. But does the system prioritize cost savings over life savings? Now, that's a harsh way to put it, but at some point, I get we're trying to be cost efficient. We're not trying to do excessive tests and excessive time. Let's limit. We don't want doctors abusing the system. We don't want patients abusing the time. But at some point, we've really structured it so you got to be really quick. And I wonder if quick is always the best answer in medicine. What do you think, Dr. Trin?
Yeah, well, quick, fast. Sometimes it feels like you're a rodent running inside the little hamster wheel, right?
I'll bet.
And there are many docs that feel that, but at the same time, you just got to do the right thing for our patients because they're there for you.
Do you envision you guys, Isabelle and Stone of the future? The medical system's changing? More and more doctors come out and work for a big corporation, a conglomerate. And their structure is different than if you have an own private practice and you can do what you want to do. What do you see the future? You think medicine's going to change in your lifetime, or are we just more of the same? More demands, quicker schedules, less cost. That seems to be the curve we've been on for a while. And I wonder if it isn't time for a reset and a rethink of how we do things. What do you think? You're just looking ahead. You're not even focused on the future yet. But what do you think, Isabelle?
Yeah, I think that the word we're kind of looking for is efficiency, trying to find that balance between using our funds in the best way possible. I know when Dr. Trin leads those global health trips, you don't have the sort of money that you would have necessarily in the US. So you got to figure out how can I deliver the best possible care with the least amount of funds. I don't know though. I mean, what we're seeing right now is a huge change in technology. And I think that, I mean, I used to work for an older doctor who definitely saw the switch between handwritten notes to typed charts. And that really decreased his efficiency because he wasn't used to it. I'm hoping that Stone and I are here more in a time where the technology will help us be more efficient and faster doctors. So I think we'll see a switch as the technology gets better, because I think that that's kind of going to be the answer is if we have efficient charting and stuff like that, we can help more patients and deliver better care. But we need to have good systems in place for that. And that doesn't happen overnight. I mean, it's a tough thing to do.
So what do you think, Stone? Are you guys going to revolutionize the way healthcare is done? The two of you starting today are going to change the medical system in the future. You're not going to accept the way it's always been done in the past. I think that's the hallmark of your generation, every generation, but yours in particular. I'm not sure you're ready to just line up and do things the way they've always been done.
Yeah, you know, one thing that I've seen that I think is going to become even bigger in the future is telehealth. I know with COVID-19, it's been harder to go in and actually see a physician for any issues you're having. So, you know, meeting on Zoom or whatever other software that physicians are using for that is becoming more important. And we're starting to see that we can use that sort of technology globally. So we can start providing for underserved areas more easily. So I think we're definitely going to see a shift as far as primary care with telehealth.
Dr. Trin's a big advocate of telehealth. He's had a number of people on here. What do you think? Is that the future? Telehealth? Does that make people more efficient? You can see doctors when you want. We're not waiting in the wait rooms for hours, and the inefficiency of stacking them up like airplanes trying to land at LAX here. What do you think, Dr. Trin?
Oh yeah, well, I'm sitting here and in my pajamas. I'll take care of patients.
Too much information. We didn't want to know that.
Oh yeah, the PJs are pretty nice. You know, got this little doctor thing from up here, but yeah, got a little drink on the side.
Exactly.
It's like perfect medicine care, right? Yeah, just rolled out of bed, didn't have to drive it. But yes, telehealth is the future of medicine. The future of medicine is really keeping our patients well at home. And if you are a patient and you didn't have to leave your home to get taken care of by your physician, by your medical team, wouldn't that be nice? You know, if you had to do labs, what if the lab came to your home? If you had to get an x-ray, what if we sent a mobile x-ray van to your house, and you know, parked in your, you know, front yard, and you just go out and get your chest x-ray and they drive away. And that is the future of medicine, health at home, because with telemedicine, most of everything we can do, most of the care that we can provide can be done virtually. I've asked a whole bunch of my friends who in memorial care who are currently, you know, seeing patients and doing things on telemedicine, and I asked them, you know, what percentage of your visits can you make an official, you know, diagnosis, an assessment, and a medical plan, right, and a treatment plan virtually without having to see the patient? Right. And the answer I got was about 80%.
80%. Wow, I would say 20 or.
Oh yeah, about 80% of the visit can, you know, of the entire visit can be done through telemedicine. Obviously, the exceptions are, you know, physical exam, you can't do that, or if you got to do a biopsy. But even looking at a skin lesion, right? I mean, you can see my freckles on telemedicine if you wanted to, right? So Dr. Natalie, who's watching this, she's a dermatologist. I bet you she can see a lot of stuff on a video screen. Right?
What do you think, Dr. Natalie? Type something in there. What do you think? What's the percentage of people, if you really were honest, how many people could you see at home versus, and maybe see more people, maybe you see better because it's a close-up. You get to see, you're focusing more because you're just seeing their face. Or does that take away the body language and all the other stuff, that the other intangibles that you're using to make a diagnosis?
Yeah. Mental health visits are all on telemedicine. I mean, you don't need to examine your patient and stick a stethoscope on them, right? For behavioral health, mental health. I don't know. I mean, Maybe don't show the screen at the hemorrhoid. Maybe come in for that visit. But the other visits, you know, a lot of it can be done through just a chat with a patient, through that history taking process, right? We can get a lot of what we need to know from just the patient history without having to put a stethoscope on them. And here's the cool thing.
Yeah.
The cool thing is that we are developing apps where you can have a virtual stethoscope, right? Why can't you have a virtual stethoscope, right? You send, you know, every patient of yours, you know, as part of their health plan benefit, they get a virtual stethoscope sent to their home. Anytime a doctor needs to listen to heart and lungs, you take that virtual stethoscope, you put it here, and it comes through on the other side for the doctor to hear. Right? That exists now, guys. The virtual stethoscope exists now. If you need to listen to someone's lungs, maybe the patient can't do it. If they had a caregiver at home, you know, they can put that virtual stethoscope on, and the sound comes out on the other end. The doctor can listen and hear. That's coming. Those apps are already here, actually.
And to take your other vitals, to take your heart rate, and to take your blood pressure, and et cetera, et cetera. All that stuff is, if it's not here now, it will be. Yeah. It's
already here. Have you guys, Isabelle, Stone, have you guys heard of remote patient monitoring, RPM?
I've heard of it, but I didn't realize how much had come along already. I thought it was more like futuristic technology. It's
already here. We're already doing it now. And I'm going to connect you guys to an organization that does remote patient monitoring so you can learn more. So we send to the patient's home their blood pressure machine. We send their sugar AccuCheck machines to check their blood sugar. We give them a scale to stand on. We give them a pulse ox, right, to check their oxygenation levels. Every time they check that, they don't have to log the results in. It gets Bluetooth directly to a hub that goes to a online cloud platform where we as doctors can see the results real time.
And imagine how that, you had somebody on talking about this before. And to me, having taken care of what Isabelle and Stone probably haven't gone through, hopefully haven't gone through, is the, you know, decline and eventual death of aging parents or grandparents or whatever. But having gone through my age, now I've gone through this with my mom, my dad, my aunt, others and stuff. And there were many times they were isolated and alone. And I'm wondering, not just did they take their pill, but what's his blood pressure today here? Did you take your blood pressure today, Dad? Yeah, I'll do that later, whatever. And there are signs along the way that somebody could have been, had they had a way to monitor this remotely, they would have gotten better care. Things wouldn't have happened. Maybe my dad wouldn't have had a stroke or other sorts of things because they would have caught these signs along the way. Again, assuming somebody's watching on the other end. But too many times these patients are isolated, they're alone, they can't get there, they don't want to get there, they're in a negative state of mind. I'm tired of doing this, I don't want to do it, I can't do it, I can't get there. And so stuff goes undetected. Okay, sorry, I didn't know until it's too late and something big happens, like a stroke. What do you think, Dr. Trin? Does it lead to better care?
Yeah, remote patient monitoring definitely gives us real-time results on our patients. We can create parameters where if the numbers were grossly abnormal, right, blood pressure that's too high, a blood sugar that's too high, that can alert the physician team, right? In the past, when patients came into my office, they would bring their little log of the last 3 months.
Exactly.
You know, this is my blood pressure the last 3 months. This is my blood sugar the last 3 months. And I'm looking at their results and I'm like, I wish I knew this 3 months ago. They're grossly abnormal, right? And what am I going to do it now? Because you've been messed up for 3 months. I never knew about it.
Right.
But with remote patient monitoring, which is live today, reimbursed by Medicare, right? But not really acclimated to physician office yet. It's pretty new. It just came live just a few years, like 2 years or so. But you can see your patient's results real time, and you can identify the abnormal numbers in real time, and you can address it immediately.
And they can even send an alert, as I understand. So there's a company monitoring this remotely, forwarding the results to the doctor in real time. Yep. And they've got some sort of robot or artificial intelligence that says, uh-oh, danger, Will Robinson, something here, we better red flag this, and either the physicians or the physician's assistant on the other end says, hey, they just told us this result's looking bad here. Because otherwise you see them every one, like you said, 3 months. You're getting snapshots in time.
This is how we improve care. This is how we lower healthcare cost, by being proactive, right, and by preventing that ER visit, by identifying problems early, high sugars, high blood pressures. If you identify the problem early and it doesn't run on for months, you've prevented a heart attack or a stroke, right? Exactly. Or diabetic ketoacidosis. Same thing with CHF, right? Congestive heart failure. We know that patients in active CHF, they gain weight very quick, right? Because they're accumulating fluid when their heart's not pumping well. And so if I got my CHF patients, congestive heart patients, a scale, right? A weigh scale that they can stand on a daily basis, and it remotely just sends you their result. I can detect when somebody's going into heart failure by increasing their weight in a few days quickly. And I can proactively identify it and take care of it before the patient lands in the ER.
And that's my biggest complaint with Western medicine in general. It's very good at reacting to emergencies. You have a heart attack, we'll get you in, we'll fix it. You got a broken bone, come on in, we'll fix it. It's not as good about proactively. It reacts in the moment for severe things. I don't know that the emphasis is on preventing. I know the health care agencies, whatever you want to call them, the Blue Crosses of the world, the Kaisers of the world, they see the benefit. They're always trying to get preventive medicine across and get you, if they can keep you out of the hospital, that's to everybody's benefit. But the old model is pay per service. So when you need something, come on in. When you don't need something, don't talk to me. And I think that leads to, what do you think, Isabelle? And we'll start with Isabelle first. Are they teaching you preventive medicine or reactive medicine? How to fix or how to prevent?
I think with osteopathic care, it's very much targeted towards preventative. I was a little bit worried, honestly, that it might be too much so, but no, we've learned very much when something needs surgery and when it needs to be a dramatic change, but when we can approach it with something a little bit more subtle and preventative care. So what we've really been focusing on is the beauty of the physical exam. There's a fantastic book. It's called Every Patient Tells a Story. And it talks about the importance of looking at the body. And that's my one concern with telehealth. And it's amazing now that we have these tools that can check it out from home. But we are really learning to look at the whole body and see if there's any problems that the patient themselves might not have recognized. And like the terrific example I can give of that is, let's say you come into an orthopedic office because your knee hurts. Okay, well, your knee hurts, so you're probably walking funny, so you might have some hip problems in the future. Let's get you into physical therapy for your hip and your knee. You're going to physical therapy anyways, so you're not wasting time going for your hip. And we're just going to prevent it from getting any worse or from spreading to other parts of the body. So, I mean, it's easier said than done. It's really good in practice to learn those things. I'm hoping, and I know Stone is planning to as well, practice those things when we become a physician.
He doesn't want to. He's busy memorizing everything right now. He has no time to worry about that. All right, so that brings up another point then, and let's take that one step further, because I don't think modern medicine, Western medicine, if you will, is set up to take a holistic approach. Maybe the family physician sort of, but it's specialized. So you come in for that knee, I'm going to focus on the knee. And maybe I don't think about the hip, or I don't think about why maybe your knee hurts because you've gained a lot of weight. And why are you gaining a lot of weight? And what does that do to your diabetes? And what does that do to this? And the whole system, Chinese medicine in particular is all about balancing the system. They're always looking at a holistic approach. Doctors are very focused on, I'm here to do this. What do you think, Stone? Is it a holistic approach, or is it a surgeon's approach, a specialized approach?
Yeah, I think, like Isabelle was saying, the osteopathic philosophy to medicine is really focused on a holistic approach, which is something that I think we both really liked about Western U. So far, we've just been going through a bunch of basic sciences and things like that, sure, but they've made sure to emphasize a lot of the connections between systems, and they really emphasize how important it is as physicians to be able to recognize these relationships.
What do you think, Dr. Trin? Are we too focused on the immediate problem and not looking at the big picture? Or is that not the doctor's role? They're there to fix whatever is in front of them.
Yeah, the current setup in the system is to ask what, meaning, what is the diagnosis?
Right.
You're here, you have these symptoms. What is the diagnosis and what is the treatment plan? We don't ask enough why.
Yeah. Right.
And so in our healthcare system, we really should be asking why. The problem is,
why does your knee hurt? Not just, oh, what's the problem? The knee? All right, let's figure out how to solve that one. Yeah.
The problem is why does not pay.
Yeah, there you go. Well, that's where I've been trying to go here, but I know, is it all about money? Why doesn't pay? Why is a rabbit hole too? Takes a long time and lots of exploration. And in the meantime, my knee hurts. Just fix it, doc.
Yeah, why does not pay? And so our system is set up to treat diseases, not necessarily to prevent. But prevention doesn't really quite pay. Especially if you're in a fee-for-service world, or if you're taking care of a lot of PPO patients, where you only get paid when a patient comes in.
Right.
Unfortunately, it's a really unfortunate situation. But if the patient doesn't come in, you don't get paid. And so what that means is if you have a super healthy patient who never comes in, then you're out of business.
Yeah.
Right. So this setup we have in the healthcare system is kind of half-assed backward, where we're not incentivized to keep everyone healthy. Now, not everyone is like that. And I know that a lot of the health systems and the health plans have moved forward in prevention, and
they talk about it a lot. They focus on it a lot. Well, I'll give you another example. Years and years ago, I took a course on Chinese non-Western medicine in college, and I was fascinated. The professor said, I don't know if this is really true, but he said, in China, if you get sick, you go fire your doctor. You were supposed to keep me healthy. You failed me. Here, that's the only time you ever go see your doctor, is when you get sick. So even the patients have it backwards. We don't come to the doctor to do preventive maintenance on the car. We only do to fix it when it breaks. What do you think, guys? You want to get, is that something you'd like to see changed? Or maybe the DO school you're going through has a different approach to that. What do you think? So we'll start with Stone this time. What do you think? Are we too focused on what's broken and not preventing the break?
I think right now we're starting to see a transition into the importance of preventative care, for sure. But I think definitely in the past, there is too much of an emphasis on fixing the problem when there is a problem, instead of preventing the problem from happening in the first place.
Okay. A straightforward answer. He's now been moved to the bottom of the class when they hear this. What do you think, Isabelle? She's going to give us the positive answer now here.
I don't know. I think that it's really easy for Stone and I to say what we want the future to be like. And it's also, we're really idealistic right now.
Yeah.
And it's our first month of med school. We want to be perfect, well-rounded, wonderful, humanistic, kind doctors who spend 2 hours with their patients, but make enough money to take vacations. We want it all. But I think you have to start wanting it all. And then, hopefully get more realistic, find good mentors over time, and then maybe make some changes for the good in the healthcare system.
Don't lose the idealism. When does the idealism get sucked out of you, Dr. Trin? Is it the second year, the fourth year, the 12th year of your practice? When do you start to get old and cynical in that idealism that I want it all? When does that start to fade?
I don't know. I'm still idealistic.
You are. You really are. Much more than most. Yeah, you're very idealistic.
Why he's such a good mentor. He's always idealistic.
He is. I keep trying to provoke him and find that real, come on, get past this. Tell me the truth. I hate my patients. I hate this. I wish this was, I'm there. And now he's just hangs in there. He's got this positive view. Is that what it comes down to? You got to love what you do, anything in life, but particularly in something this intense and stressful. What do you think, Dr. Trin? Is that really what it comes down to? At the end of the day, nothing's perfect. But if you're going to make it through it, you got to love what you do.
You truly have to love what you do, especially if you're going to sacrifice 4 years of college, 4 years of medical school, 3 to 5 years of residency. And you're sacrificing your youth to be a doctor. Most people don't finish until they're 30-ish.
Yeah, right. Exactly.
And so if you don't love what you're going to do, it's not a good thing after the sack. Not mentioning the $200,000+ in student loans.
Unbelievable amount of money these days. How does that? Because I've had doctors tell me privately, that's why they wanted to do something else. They wanted to go into private practice. They had some other ambition, but I got this giant monkey on my back when I come out. I got to go pay this thing off. And so maybe I don't pick the career that I really wanted. Maybe I go work for a big giant corporation that'll start paying me money right away here. I don't know. That's a disturbing fact of life that you guys face with. Do you fear that at all, Isabelle, this monkey? Or are you just, she's independently wealthy. I can tell she's got money. Girl's got money like crazy here.
Oh, I don't know about that. I am very fortunate to have parents who are supporting me through this for the most part, and I owe them a lot, financially and supportive in every way possible. They've been phenomenal.
Free healthcare for life. How about that? Let's give them that. Yeah, right. Exactly.
Yeah, for sure. I will just say that I don't want to let that get in the way of me doing what I love. And again, that's an idealistic answer, but I think you can find a way to do both, because if you're going to be a doctor, you're going to be able to pay it off eventually. So make sure that you're not getting rid of your happiness for the money. Try to get both.
What do you think, Stone? Got any fears of the debt you're piling up?
I mean, it is something that I do think about. I am going to have a lot of debt after 4 years here. And that's something that I'm going to have to think about and plan for realistically. So it is a concern of mine. However, right now, at least, I'm trying to embrace the moment, learn as much as I can to be the best physician I can be, and hope that, the school and that with the help of my friends, that I'll be in a position where I can eventually pay those loans back.
Well, yeah. The secret I'm going to tell you right now is cryptocurrency. You should be mining cryptocurrency in your rooms right now while you're studying. Exactly.
We should start our own crypto coin,
I think so, yeah.
Drop out of med school and do that.
Med school
make the money worthwhile.
Yeah, exactly. You need the tongue out coin. It's got a little tongue out in the coin. And so, who knows?
Well, an amazing assemblage here. As much as I tried to rattle them, as much as I tried to get them to say, come on, tell me the real truth, they still present an idealistic, hopeful view of the future. I hope you never lose that. And I hope that you learn along the way. I hope you guys are the future of medicine, because I think we have a great medical system, but I think it could be better for all the things we talked about. Focus on the whole. Let's not make it all about money. And let's find a way to expand service and get more efficient. All those things. Yeah.
What is your average day like if you were to look at it hour to hour, Isabelle, or Stone?
We'll start with Isabelle. Ladies first. I'm old.
Typically get up at 6 and then do a little bit of what they call lighter reviews. So the easier review stuff in the morning to kind of get my brain going. Lectures then from around 8 to 3 with maybe a 30-minute break for lunch in the middle there. And then I study 3 to 8, dinner till 8:30, and then I study till 9. And then I try to cut it off at 9 every night. So you're looking at 14-hour days. But some days you just take a break because you need it and recharge, and that's really important too.
I don't want you to feel bad, Isabelle, but Stone's going to tell you his numbers. He never quits at 9:30. He goes to 11.
I know. He secretly says where he's done studying.
Oh yeah, no, he just tells you that because he wants you to fall behind a little bit there. Oh yeah, I quit about 8. Why don't you quit at 8, Isabelle?
Absolutely not. So yeah, my schedule's pretty similar to Isabelle's, but so I wake up at 6 But right away, for me, I like to go into the new material. I think early in the morning, I can take in the most new material. So for me, that's the most beneficial. But then, so we're watching lectures probably 4 or 5 hours, and then lunch. And then I'm studying stuff from previous days. Mm-hmm. And then I'll probably work out maybe around 4 or 5, have dinner, And then a lot of days me and Isabelle will get together later that night and go over today's stuff.
Yeah, because you're trying to tell her to quit studying so you can move up the rank there. I know this is working. There's a little mind game that's going on here. Watch it, Isabelle. He's definitely messing with you. And
I know. He's all like, you don't need to work out today. Or like, oh, go do a 3-hour workout. You have time.
Yeah.
Like,
and then he's like, yes, I'm going to get ahead now. I'm going to go study. I'll be so
You
far
find
ahead.
workout time, huh? That's good. That's great.
I need it. I think Stone and I both, that's like a mandatory needed every day. Some people, it's a nap, it's sitting outside. We all have something. And I think working out is number one for Stone and I.
I think I did not do that in law school to my detriment. I think that's part of the reason I got unhappy and unhealthy and depressed and all sorts of things, because I was so focused on the grind. I didn't take care of me along the way either here. Well, it's an amazing tale. You're so bright-eyed and bushy-tailed. You're so hopeful for the future here. What do you think, Dr. Trin? Is this the future of medicine right here?
Definitely the future. These guys are the future. They're going to mold the future of medicine and pave that path. And so we're looking forward to watching how you both do through your next 4 years here, obviously. And
you're going to come back. Isabel's going to have a cigarette hanging out of her mouth in 3 years, and she's going to be tough and this medicine thing, whatever.
I'll be bitter one day.
Bitter and old. Stone will have a bottle of Jack next to him here, and they'll both be going, this medicine thing, whatever.
Yeah. Well, we're gonna have you guys back, and maybe toward the end of your first year, and give us a recap. Since this is just, month number one.
This is the fairy tale. This is the Disney right now. Little birds are flying around your head, and and everything is like, and little munchkins come by and sing every morning to wake you up, and the birds tweet outside. This is nothing but a happy movie right now here. Wait till you get into it about a year from now. Then
I'm still bothering with the eye cream to pretend like I don't have bags under there.
Yeah, right, exactly. Come on. We want to see the struggle. Well, it is a struggle. There's no question about it. You've taken on an inhuman task that few humans can handle. It really is. As they made us very clear in the law school, you are part of the elite. Whether you want to accept that or not, you are the chosen few, and of which much is demanded and much is expected. So I look forward to riding along, seeing how you rise to that challenge, because I think you will. You both have the right attitude, and you seem to both want to do this. So that's the key.
Yes.
All right, Dr. Trin, take us out.
Hey, good to see you guys. Thank you, Stone and Isabelle. And I'm sure we'll be chatting more with our other projects, right? And so thanks for coming on and letting folks know what life is like for medical school and your optimism. And we're going to follow your lives here on OC Talk Radio.
There you go. Wouldn't that be cool? From beginning to graduation here, and to watch that evolution along the way. This would be a great reality show. Why haven't they done a reality show about med school? Oh my goodness.
I think when they graduate,
be a horror movie, not a reality show.
I think when they're ready to graduate, Paul, we should bring OC Talk Radio to the graduation and film and watch them walk across.
Why not?
We followed the lives of Isabelle and Stone through the years. It'd be kind of cool, right?
That would be very cool to do. All right, we look forward to it. From your lips to God's ears. All right, we'll make it happen here. All right, thanks, guys.
Thank you.
Well, there you have it. One more good reason to tune in. Because we're not just going to talk about tips and health that you can do. We're going to bring experts, and we're going to bring people who are the future of medicine. As we look forward to more health talks with Dr. Trin right here in Orange County's only community radio station, OCTalkRadio.net.